our update today is to provide an update on vaccines. We did receive an additional allocation of vaccine from the state via the federal government. So we did receive an additional 720 doses of vaccine last week on Friday, I believe, which is now available to folks in our community for who are at greatest risk for exposure to monkeypox. In addition to the new vaccine that's been delivered and available to us, the state issued guidance on Friday that we now expand our eligibility criteria beyond the groups that I described earlier. It's a very small expansion, but it is important for folks in the community to be aware of this expansion. And so I'll just review the groups who are eligible for vaccine as of effective today. So the first group, and obviously the most critical group, is anyone who's come into physical close contact with someone who's been diagnosed with monkeypox in the last 14 days. And those individuals obviously are being identified via case investigation and contact tracing. But of course, if anyone is self-identified or is told that you've been exposed to someone with monkeypox, either here in Mecklenburg or outside of in another jurisdiction, please notify the health department immediately and you are eligible for a vaccine. The second group are anyone who identifies as a man who has sex with other men or transgender individuals who report any of the following in the last 90 days. Again, 90 days is different. This was 14 days previously. Having multiple or anonymous sex partners, being diagnosed with a sexually transmitted infection of any kind, or receiving HIV pre-exposure prophylaxis or PrEP. So again, any MSM or transgender individual who report any of the following in the last 90 days, having multiple or anonymous sex partners, being diagnosed with a sexually transmitted infection of any kind, so that includes syphilis, gonorrhea, chlamydia, HIV, etc., or individuals who are receiving HIV PrEP and identify as men who have sex with men or transgender individuals are now eligible to add themselves to the wait list for a monkeypox vaccine. This represents a transition to more of a prophylactic approach in terms of vaccinations. We recognize fully that we still have well over 600 people on the wait list here in Mecklenburg County. So we are going to be offering appointments for the new vaccine to individuals on our wait list on a first come, first served basis. I encourage individuals who are now eligible because of this expanded criteria that the state has released to go ahead and add their names to the wait list as well. As of this morning, there are about 688 individuals on the wait list here in Mecklenburg County. That includes our residents, but also residents in this region. Most health departments around us are not administering vaccine, and so we're the closest one for quite a ways. I think Forsyth is the next closest. And so we are serving not just Mecklenburg County residents, but folks across the region. So if they meet those qualifications, again, I encourage them to go to our website or call the hotline to add their names to the wait list. The next update and the next and final update I have relative to the vaccine rollout is that we've also been given guidance by the state to no longer reserve second doses and only administer all that we are allocated as first doses in an effort to expedite vaccinations, as well as to make sure that we're doing everything possible to work towards containment. And as you all may know, this is a 2-dose series, and so it's 1 dose and then a second dose 28 days later. And we had been previously reserving doses for those individual second doses, but it's been communicated to us that we will have vaccine in 28 days for individuals to receive their second doses, or at least close to there. And so we should go ahead and administer the doses we have on hand. And so we are making additional appointments available through the scheduler today, which will basically, it won't be open to the public because we're working from the wait list that's already very long. And so we're going to try to get as many of those folks into our clinics over the course of the next 2 weeks or shorter order as quickly as possible to get through the vaccine allocation that we currently have. For individuals who've already received their first dose from the Mecklenburg County Public Health Department, we are continuing to retain those individual second doses so that we can ensure we have vaccine for those individuals in about 2.5 weeks. I think this is the earliest that folks will be coming back in for that. But for others, we will schedule your appointment for the second dose at the time, but we won't keep that dose in the freezer because we need to move as quickly as possible to get the vaccine out to folks. So those are all of my updates for today, and I'm happy to take any questions.
The first question today is Brett Jensen, WBT Radio.
Hey, Dr. Washington. Sorry if my internet is a little spotty. Real quick, in terms of what you guys are seeing in terms of symptoms and what's happening, since now it's becoming more prevalent, you're getting a better understanding and can see it firsthand. Is everything pretty much still the same? Long-term firsthand, more severe than chickenpox, but the symptoms last a little bit longer, but still not fatal and stuff. I mean, is everything pretty much what it was?
So, Brett, I think I got most of that, and I'll go ahead and pass it to Joy and let her sort of chime in on sort of what we're seeing in terms of the cases that we've talked with, and we've talked to all of them.
Yes, and so we're seeing our cases with pretty mild symptoms, but yes, the same symptoms that we've discussed. We do follow them out for a period of 21 days, so there's still stuff to learn, but that is what we are seeing.
And I guess, I'll comment too, relative to the urgency of the situation, beyond the current cases. Again, they're all been adults, but of course, everyone's at risk for monkeypox infections. And so for some people, we know the infections can be more severe, specifically children, as well as older adults, people who are immunocompromised. And so that's why we're so laser focused on trying to contain community transmission, so that we don't get to a place where we have those folks who are at greater risk of being really sick. And, in some cases, for example, kids who are not eligible to be vaccinated without a special approval, we're able to avoid transmission or exposure to those individuals.
Next question is Ashley Mahoney, Axios, Charlotte.
Good afternoon. Thank you for your time, Dr. Washington. I apologize, my internet cut out earlier when you mentioned the number of doses that were received on Friday. If you could verify that number again for me.
Certainly. So we received 720 doses from the most recent allocation.
Okay. And when is the next round of doses set to arrive?
Excellent question. I don't have a definitive answer to. We have been receiving them sort of on a weekly basis at this point, but the next phase is when the CDC shifts into what I think is being called phase 3. So I don't know the exact timing of that. It may be as early as this week. It may be next week. I'm not certain. So we'll certainly keep you all posted. I have not yet received an allocation or an allotment from the state or an estimate of a delivery. So when we learn, we'll keep you posted.
And that 720, is that the total number that the county has at present, or that was strictly the amount that was brought in on Friday?
That's strictly the amount that was brought in on Friday. I don't have the exact number of how many doses are in our freezer right now, but I can tell you that we have administered almost all of what we had received previously based on, allocating first and second doses. And our team right now is working to schedule appointments from the wait list that we have for the new 720 that are now available to us.
Thank you. And just a quick follow-up, if I may. In terms of big picture, the number of vaccines that the county estimates it would need as a whole, is there a ballpark figure for how many the county needs?
It's a really difficult question to answer because it requires us to have a better understanding of specifically the population at risk. And while we have some estimates of the number of people who are actively on PrEP, for example, or estimates of the number of people who've had an STD in the last 90 days, that number is still something we're working to produce a reasonable estimate that could be used as a target, I guess, if that's what you're asking. So I don't have a number today of what we would need, but I can guarantee you it's more than we have to date received roughly 1,300 doses, so it's more than that, and probably a lot more than that. So I expect today's announcement will certainly increase our wait list, and demand will continue to go up as more people are eligible. And so we are working to advocate for obviously as much supply as possible, given obviously the way the outbreak is escalating here in Mecklenburg County.
Thank you.
Next question is Vanessa Rufus, WCNC.
Hi, I have two main questions. So I'll start with my first one. Have you gotten any cases that have been spread via respiratory droplets, from which I understand is possible, but a little bit harder to do?
Hi, from our case investigations, it looks like all of our cases were spread via close or intimate contact, not via respiratory droplets.
Okay, and then my second question is, I've been seeing the past couple of days, several high-profile doctors take to social media saying, if this becomes endemic, this is going to be one of the biggest medical travesties that we've seen in recent years. Do you have any concerns that this is on track to being endemic at some point? Do you feel like we're doing enough to prevent this from spreading further? I guess, what is your viewpoint right now on how we're handling this and whether more needs to be done, either from a federal level down or any other way?
Yeah, Vanessa, great question. I think in general, what I would say back to that is, right now we've got to be laser focused on trying to avoid widespread community transmission, particularly in areas of high impact. And so given that we have a limited supply of vaccine, which is a very effective tool to help us prevent community transmission by vaccinating those who are exposed or at great risk of being exposed at some point in the near future, that is the greatest limiting factor we have right now. And I know our federal partners are working to procure as much vaccine as possible and to get it distributed out to states who then can distribute it out to local health departments and other partners. So that's certainly a limitation. I'm very pleased with where we are with testing capacity in the county, state, and country. I think we definitely have some ways to go with education among providers. We locally started our education efforts about 2 months ago when this first started in the country because we wanted to make sure we were prepared. And I'm very proud of our team for working with our provider community to provide education and to make sure we were communicating. That being said, we've got to reinforce those messages from 2 months ago and even 2 weeks ago because it's becoming more prevalent and our incidence is going up locally. And so more people are being impacted. And what we don't want to happen is folks to not seek care or not be able to identify or find a provider to get testing at. And so we need our provider community support. We need all those sort of players, our health systems at the table as well, which they are, to assist us in the testing process to make sure that we're identifying cases quickly, isolating them, and making sure that any close contacts are vaccinated to avoid any further transmission. So that's our focus and our goal. And I think locally, we're certainly doing what we can do on that front, as well as on the outreach and education front. And really why I'm doing this today, and we will keep doing these as needed, is also relying on our media partners to get the word out to the public, to look out for signs and symptoms, as well as to know who's available, who's eligible to be vaccinated, as well as encouraging folks to get tested if they're experiencing symptoms.